Okay, so we need to. Okay. Good morning, everybody. I hope that you are well, and I hope you can hear me. We will perform a necropsy with a young calf of bottlenose dolphin. This dolphin has been found along the central Tyrrhenian coastline. We have our colleague Cristiano Cocumelli here, that belongs to the Istituto Zooprofilattico Sperimentale of Rome, which is our public veterinary person. I would like to thank Cristiano for providing this very fresh carcass. Before starting the necropsy, I have asked to Cristiano to just briefly tell you about the trending rate and cause of death in the area, just to give a findings we are going to during the necropsy. Main goal of today is to apply by catch diagnostic framework, which is the document I have just sent to all of you, and I have shared also by. The framework is a document developed within the Life Delphi project, so a Life European project aimed to reduce the interaction between dolphins and fishery activities. The framework should it wants to be a support, a tool for your postmortem investigations. It has been developed according to the best practice documents. So it is tiered to different levels. In tier 1 and 2, you will be able to assess any fishery interaction, while in tier 3 we should be able to tell and estimate, evaluate, and hypothesize the cause of death of the animal, and if the fishery activity is the cause of death. Of course, the diagnostic framework doesn't want to substitute any necropsy protocol. I mean that it is not a shortcut. But it is just the way to collect properly postmortem evidences and trying to support the interpretation on we find during the postmortem investigations. I will stress this fact again because it's important to know that one of the major findings that is consistent with bycatch is the absence of any other ongoing cause of death, which means that we have to exclude any other disease before telling that the bycatch is the real cause of death. So before starting, I will let the floor to Cristiano. Cristiano, come here, please, which is close to the animal. So Cristiano can tell you about the epidemiological, say, so in this way, the situation of the central Tyrrhenian.
Okay. Hi, everybody. I'm Avet. As Sandro said, I work in the Zooprofilattic Institute of Rome. We are responsible of about 300 kilometers of coast of our region, and most of the strandings comes to our institute, or we go to take the animal to make necropsy. This is only the 5th animal. Not unusual number because now about 10, 12 dolphins per year. Only now. The main species are truncatus, bottlenose dolphins, as in this case, and Stenella cerure alba. So the animal of this conservation because, as everybody said, And unfortunately, I have to say the same things. We deal most often with animals with the state of conservation, state 3, 2 in the best cases, as this one. This one is a young animal, and also these things is not usual in our country, in our coast, because most of the animals were adult and female or male in the same proportion. We trying to establish the cause of death of this animal, and in our experience, most of the times we found some infectious agents in animal. The difficult things is to establish that this agent is responsible for the cause of death. We do not succeed in establish these things every time. It is not usual instead to find lesions related to bycatch or entanglement. And this is something different in respect to other regions of our country, where other colleagues have experience in entanglement most often. So we are going to open this animal to try to understand what's going on.
Thank you, Cristiano, for giving us the opportunity to see this fresh modern dolphin. So this is a very young animal, as Cristiano said. We can say that it's very young based on the morphological features, not only on the total length. So here you can see the animal. You have no teeth already on the gums. Okay, it's you can see here some holes which are resembling the remains of hairs being presented during the very early months after the delivery. And the tongue, you have these features which are resembling a very young animal. Other features that can give you the idea of the age are these stripes, white stripes, which are the fetal folds. Okay, I think that's are typical of a very young or a newborn animal. Of course, the umbilicus here is closed, which happened after 2 months about after the delivery. So we can say that this animal was older than 2 months about, and the total length is 1.33 centimeters, so 133 centimeters that support our hypothesis. The animal is a male. Okay, so here you have the genital slit. It's on the dorsal fin that can help us in recognizing the animal with a matching with previous photo ID. So now we have the history of this animal. This animal has been frozen for this training, so we cannot give a decomposition code of 1, which was at the very first when the animal was found, but we have to deem as a DCC2. Regarding the nutritional condition, we can observe here the features of the external appearance seems an animal in good conditions. So nutritional condition 3, which is the average. There is a very small depression here, but it's quite normal for this age. Okay. So the other steps in the best practice document in the necropsy protocol is starting to collect information of external findings. So we can look at the external features and evidence of the animals. The first things that we can notice here is there are some linear impression. They seem to have sometimes they cross one each other. You can see better close to the eyes. Hope you can appreciate. Okay. Of course, they are reducing. There is a small laceration here, close to the the pectoral fin here. Yeah, there is a small here, another laceration here. Okay, and again, going on the dorsal fin, there are these two linear cuts, 1 and 2. 3, there are more than 2, which are quite a regular one. So turning the animal. We have a similar evidence also on this side. So here, as you can see here, there are these stripes, these marks, quite evident. And again, another laceration mark, linear mark, very clear at the rostral attachment of the so these usually are considered as a gear impression. We have no remain of gears or fishing gears outside that are entrapping, that are enrolling the any appendages. We have no lack of appendages. So these are the most common findings that we can observe during some type of marks and impression that can suggest that a net was responsible of these different marks. Also here, close to the eyes, which are, it's very clear. Okay. Of course, these marks and impressions should be differentiated from other causes. For instance, they could be also due to stranding events. So some marks given by rocks or the transportation of the carcass, but it's very difficult that they can leave a so regular impression. And also on they should be differentiated also from rack marks, so the intraspecific and social interaction we have here. For instance, this is rack marks, so it's clear that they are linear impression and scratches given by teeth with a regular distance one from each other, but they're not linear, they're just curved, and they're of course a part of a normal social interaction between the same species. Other relevant gross findings that can be observed during the a gross external examination depend, of course, on the type of fissure interaction we have, but we could have the bulging of the eye, which is not the case in our dolphin. So we should have the eyes that came out from the orbital, the orbital, but it's not the case. So this we will then summarize all our findings in a specific table that we are going to use. And then the other features are we can observe other findings opening the animal while we perform the complete necropsy. So now we are going to open the animal. We are going to approach to the animal systematically according to the best practice documents. And in this way, we could collect not only information related to bycatch, but of course also related to other possible disease or changes ongoing. Maybe if there's any question, now we can stop, well, we can open the floor, Camille, in order to collect now some questions, and then we can go further with the next steps of the necropsy.
Okay, if you wish.
Yeah, maybe it's better to collect all the questions if there's any.
I haven't seen questions in the chat yet.
Okay, but so we can go ahead. If you have any question, you can ask in the chat, and then I will collect and I will reply to your questions when in some break during the necropsy. So the approach is opening, so detaching the skin completely, and doing this, we will measure the blubber and we will take some samples. At the end of the gross necropsy, I will show you how and what samples and how to collect the samples for the different problems we have to investigate. And in a couple of weeks, 3 weeks maximum, I will upload a presentation with all the results, including the microscopic examination. So you can also follow the follow-up and the subsequent analysis we are going to implement to confirm or to understand the cause of death. So just to give some other anatomical features, here you have the external ear. The animal is fresh, so you can see here the external ear meatus, this very small hole. And I think that Stefan and Michel-André talk about this. Okay, we can now measure the blubber. One 12 millimeter. 11 millimeter. And 11 millimeter. So we measure the same point, and by using a ruler, and in 3 different locations. Now we have to touching the skin, and the 2 things that we are looking at and we should pay attention is the presence of any discharge, edema, hemorrhages, parasites, but also gas bubble. So it is important to perform this step carefully to avoid to lose any evidence of possible gas bubble. Gas bubbles should be found within the vascular elements, not just under the subcutaneous tissues. So at this point, this is the scapula. Okay, this is the scapula. At this point, you can see some lymph nodes. These are the lymph nodes, which are called prescopular lymph nodes. This element here. So we sample. No, this should be sampled for virological analysis, but also for histology. Usually, in case of infection, you have a larger, the size of these lymph nodes are greater. So here again, and here you have the biggest one. But we have to, when you have a very small animal, it's also quite normal to find larger lymph nodes than in adults. And to identify a systemic disease, you should find an increased size of the lymph nodes in all the body, not just limited to one single point.
Riusciamo a tamponare la cascata che arriverà.
Okay, so the color of the muscle is not the normal color that we find in adults. Usually it is darker. The pale feature, the reduced intensity, of course, it is related to the age of the animal. So it's normal for the age. Here you can appreciate the vessels, the subcutaneous vessel. So by looking for any bubble, you should find here at this level, it's easier to see them.
Un secondo, io lo faccio e faccio vedere dove siamo.
Okay. Here you can find the small bones. If you want to reconstruct the skeleton, you have here the pelvic bones, which is very, very small in this animal. You can just perceive by touching this, and we will try to recover them later during the necropsy. Okay. We can go further by opening the mouth. There are some red features here, but we have to also to consider that this animal was frozen, and so this could be part of the frosting process. Here you have the fat bodies, which are used for the sound perception. The fat bodies are here, and on the other side, within the mandible and within the jaws. So here we can look to the hyoid bones. This is the hyoid system. If you want to reconstruct the skeleton, you have to also to cut these bones at the joint level. Okay, now we have the tongue outside, and here you can see all the folds that are typical of a newborn. Okay, we are now arrived at the important point, which is the larynx extraction. You know that in some areas of the Mediterranean, larynx entanglement is a relevant problem, particularly in the Adriatic. I don't know in other parts of the Mediterranean, but there are some. The larynx entanglement, you can assess the larynx entanglement in, sometimes you can see some gear coming out from the mouth, but in most of the cases, you can find the gears just around entangling the larynx, and these are in general monofilament nylon gears used for sand nets, and in particular for coastal fisheries. And this is one of the relevant problems we have, at least here in Italy, but also in Croatia and Albania and other parts of the Ionian and Tyrrhenian Sea. So it's important to the larynx is here. You can both enter through the pharynx and dislocating the larynx and then cutting. And here you have the larynx outside. So in this case, we have no nets entangling the larynx. You have some fluids coming out, bloody fluids, viscous bloody fluids, and we will see, and there's some bloodish fluid coming out from the larynx. Okay, I will now open the cavity. If you want to do some question after the opening the cavity, I will then reply to all your questions.
In francese dei messaggi.
So now we can open the abdominal cavity before and then we have blood coming out from. What's more than blood is a bloodish fluid. In case of a young animal, you can use the knife to cut the joint because it's very easy to. Otherwise, you can cut the different ribs if you want to preserve the skeleton. So you just cut the ribs and go directly to the vertebral column. The other option is using dedicated scissors for opening. So,
Les Marocains en consomment 70 tonnes par an.
Piega in su.
okay. So, is there any question? From the floor? No question?
Yes, Sandro.
Sandro.
Sandro,
Yeah.
you had one question in the chat.
Yeah. I cannot read, so if you
You
can
cannot read. It's in French, but anyway, they were wondering about the curve, the lines near the caudal fin.
okay. So this one.
Most likely.
So if you don't understand, but maybe the question was related, maybe what they are.
Yeah, what they are exactly.
So these are they are the impression of teeth, maybe of the mother or of other Boden's dolphins. If you look, so they are just impression of teeth, and they are typical rack marks. They are called rack marks. So here you can see they are parallel one to each other and at the same distance. And you have this here and another one here. So it's nothing related to fishing interaction with the fishing activities, but it is showing interaction with another dolphin, which is normal, of course, for a young animal, because the mother is touching the animal, biting the animal, and so on. But also in case of young males and during mates on females. So it is something that we should differentiate with the marks given by the fishing gear. But they are normal.
The bigger organisms, do we cut the upper? I lost it. Can someone read the other question, please?
Yes, you have a question from Thierry. Thank you, Sandro, for the demonstration. Do you have pictures of the larynx entanglement?
Yeah, but I cannot read, so if it's possible, someone can. Oh, Thierry,
Yeah,
do you want?
You.
So, Sandro, I may. Do you hear me?
Yes.
Okay, thank you for the demonstration. I was aware if it was possible to have pictures of larynx entanglement.
Yes, we can provide pictures of that from previous from previous necropsies. As Cristiano said, most of the time we found not well preserved animal. There are some papers from Croatian colleagues, but also some nice pictures from the most fresh ones. So I will provide with the presentation that I'm going to upload within the middle of.
We cannot hear you, Sandro, anymore.
Can you hear me?
Yes, now it's better.
Okay. I was I tried to repeat. So I will give pictures of the larynx entanglement within a presentation that I'm going to give to the participants along with the rest of the necropsy. So the rest of the analysis we are going to perform here to explain also what is the larynx and how you can see the larynx entanglement.
Because recently that was on a seal, on a harbor seal, have a similar finding, but with a fish entangled in the net, and the net was blocked in between teeth, and the fish entangled in the net was over the larynx, and it seemed that there was not nuanced net, but there was cotton, then less fragile, more fragile, less resistance, and perhaps there is this is also the consequence of new net that are used now. I don't know.
Okay. Yeah, there are similar findings here also in other species, like in particular in Mexico, for instance. There are some reports, but of course, I'm trying to provide some pictures from bottlenose dolphins and the most fresh we have. What I can say is that during the larynx entanglement, you have besides the gear remains, you have also a change in the structure of the larynx, a chronic, which confirm a chronic larynx entanglement with hyperplasia and a clear changes in their architecture and structure of the larynx.
Okay, thank you.
You're welcome.
Okay, Sandro, you have another question.
Yes, please.
It says, with bigger organisms, we cut the upper joints of the ribs, since cutting the ribs are a bit difficult and hard to do?
Yes, of course, I know. In our case, we used to, since most of the sperm whales, for instance, or of the fin whales are used for museums, we are used to take off ribs per ribs. It's a hard work, but we have to do that. Otherwise, you can, it depends on what you are considering big organism. I mean, if it's an adult bottlenose dolphin, you can use the scissors here, which is, we use also for bovine, for instance, for horses. Otherwise, you can use a chainsaw or a hand saw that is used for slaughterhouses, for instance, which is quite cheap and not so expensive compared to other tools. So yes, it depends on the final destination of the skeleton. This is the basic. So when you know where the skeleton and the remains will go, then you can decide what to do with and how to open the animal.
Even with adult tursiops?
With adult tursiops, so you can use the saw, the hand saw, and these scissors like this. They are quite comfortable, not so expensive, because it's something that is used for gardening, so nothing relevant. And so you can buy this in storages dedicated to gardening, but also you can use tools for slaughterhouses.
Tilen shared the paper about larynx entanglement.
Okay. Thank you, Tilen, for doing that.
Thank you, Sandro. There are no more questions for now.
Thank you very much, Camille. So now we can go ahead with the evaluation of the gross findings in both the cavities, looking for other evidences that can suggest a possible interaction of fission activities. First of all, lungs. Now we are going to extract the lungs later on from the carcass, but now we can see if there's any excess of air within the lungs. There are some bubbles, as these white areas is you can see here is a emphysema, means that you have more air within the lungs, which could be also normal. I'm not saying that it's always connected with bycatch, but this is a good suggestion here. When you compress this part, you can perceive some the bubbles and the air moving. Here you have the heart. Okay. This is a young animal. I'm going to show you later also the thymus, which is important for infectious diseases. Here you can see the three different stomachs. So the first chamber, second chambers. Here you have the liver. This is the spleen. Again, an important organ for infectious diseases. To look and find some evidences of bubbles. Maybe you can see here. We have some bubbles within the veins. Which is not a relevant evidence if you find the bubbles just in the mesenteric veins, because having gas in the mesenteric veins could also occur when you have postmortem gas within the intestine. It's important to collect information on bubbles evidence also in other organs, subcutaneous, mesenteric veins, coronary vessels, we will see later on, around the kidneys. And there is some air here. You can see this bubble here. And also here, there are some bubble. We will appreciate more in detail by touching the organs and looking at examining the organs outside from the carcass. But now it's important to have a complete overview. The other location of air is within the lungs. Here you have the testicles, of course, very small. And again, I'd like to point out also the adrenal gland. This is the adrenal gland, which is important to assess any stressful condition or any other disease like toxoplasma, for instance. So after having done an overview of all the possible gross changes associated to the organs within the one by one, and help us in defining the cause of that. So Cristiano was asking to perform a blood sampling to perform a serological examination that can help also to understand the previous infection, also maternal infection. So this is the aorta. This is the So The other things that we have to look at are these lymph nodes. These are pulmonary lymph nodes, which again, they're important in case of infection, in particular morbillivirus infection. But we will sample later on. Now I'm closing the esophagus in order to avoid any leakages of GI tract material, GI tract and food coming out from what you can see here is milk. We will then assess the presence of food remains later on by opening the stomach. Okay. Okay. I'm sampling the spleen. The spleen is very easy. You can just detach the spleen. Then observing here, you have other lymph nodes. Then can be sampled, and very close to the stomach, you have the pancreas. Here you have the pancreas. So this is quite unuseful to collect in a frozen animal.
Oh, the image is frozen.
The image is frozen.
Yes, it's coming back. Yes, it's okay. It's okay. Go on. Sorry.
Okay. So here you have the pancreas. I said it's quite unuseful to collect for histology, but it's good because the animal was frozen. But of course, it's good for parasitology. We will collect later on. And now we can start detaching the entire GI tract. So here you can see the lymph nodes.
Sandro, if you can hear me, we cannot see or hear you anymore.
Yeah, I hear we are here.
Okay.
We lost. Okay, I was telling that this is the rectal lymph nodes that can give you the difference between the large colon and the rectum. So we close again the last part of the intestine to avoid any leakage from the GI tract. and we can start detaching also the GI tract from the liver. And the liver, of course, is an important organ for several postmortem investigations. Okay. So now we have the whole GI tract. We are going to clean and examine later on. And the liver here. Now my colleagues are going to weight the liver to clean in order to perform and examine the organs outside from the body of the animal. So here, one of the adrenal gland that we are going to sample. This is the left adrenal gland. By cutting transversely, you can measure the cortical surface layer with a medulla, and then trying to have some measures. And this part is the part of the urogenital tract. So we can examine later, again, collecting the proper tissues for life history examination. So while waiting for the organs, we can start collecting some samples for muscle microscopic examination, because one of the most important things that we should assess is the so-called capture myopathy, which is a stress-related syndrome that are led by the stress axis, the hypothalamus hypophysis adrenal gland axis. And what we are looking to are damages, degenerative and necrotic damages to the muscular tissues of the longissimus dorsi. In particular, according to the best practice document, we should sample this area, muscles coming from this area. So we can now take a large part of muscles, and then in a second time, we can use this sample both for histology, but also for ecotoxicological studies. And so we can sample from this part a small piece of tissues for microscopic examination, so looking for microhemorrhages, for immunohistochemical analysis by looking the distribution of the anti-myoglobin and anti-fibrinogen antibodies, and then of course taking samples for DDTs, PCBs, and heavy metal as well, like for other organs. The final part of this step of the necropsy is touching the head in order to take samples from the brain. So we trying to find the atlanto-occipital joint here. and it is quite easy for a small animal. Here, as you can see here, we have the medulla, and you can, if you are not able to open the skull, at least you can take some samples for virology from here. If you are able to open, it's not so difficult. Now I would ask to Jean-Marie, which is our anatomical colleague that you already know from previous lessons, to take care about the skull and opening the brain while we are examining the other organs. You know, maybe Thierry already explained that to open and extract the inner ear, you have to detach the mandibula and then looking carefully where the bulla is, which is here. But this is not the goal of today. Today we are going just to open the brain, and we will look at the brain and sample also for virological investigations, in particular for morbillivirus, herpes virus, Brucella, and toxoplasma as well. So, is there any questions while we are preparing for the organs examination?
No, Sandro, there are no questions in the chat for the moment.
Okay. Do you want to have a break or 2 minutes of break?
If people want to go.
No, we can
coffee,
go
grab a
till the end.
coffee,
Just a question. Okay. So just we are organizing. So the next step. Okay. Okay, we use this floor because it's easy to have measurement of all the lesions. Ale, pinza bisturi. Okay, so now we can appreciate all the different features of the first part of the GI tract, and also for the respiratory tract. So here you have the tongue. You have some different glands here. The pharynx. These small nodules here you can see are follicles related to the lymphoid tissues that you can find in the pharynx, sort of tonsil and a specific defense. When you find the larynx entanglement we mentioned before, and you can see in the picture of the paper, will find a wire or lines or gear around this part, and the shape of the larynx will totally change. Of course, this occurs when dolphins take prey from sad nets and similar nets, and this could lead also the GI tract, is the esophagus. And here you can also have some fresh prey. but this is something very.
Sandro, be careful, you have a low Wi-Fi connection.
Yeah.
Ok, posso cambiare col mio?
So,
Digli 2 minuti.
so a couple of minutes, we skip to another mobile.
Okay. Sandro, just to let you know, we can see, but we cannot hear. Your mic is off.
Okay, can you hear me now?
Yes, we can hear you. Thank you.
Okay. No, I'm sorry for this. I was looking to the different features of the GI tract and the respiratory tract. So here you find the pharynx, larynx, and the esophagus. And now I will show you some other features. So turning this part, you can see here these tissues. Gray tissue is the thymus. So you have the thyroids. Okay, the two different parts now, cutting the different cutting the tissues, we have the tissue spread all over, but this is the thyroid glands. The heart. On the heart, you can see there are red discoloration. Looking to the coronary vessel, we have no bubbles, which is another important site to look at the presence of a possible. So no bubbles here, no bubbles at all in a different heart vessels. Si vede? Deve stare distante. Non serve marcaci.
Va? No?
Ma cosa che non va?
Il mio telefono. Va?
Okay. Okay, now we switch to another phone. Can you hear me now?
Yes, we can hear you, Sandro.
Yeah. Okay, so very briefly here, there is no bubbles in the coronary veins. And so now we can open we can detach the heart from the rest of the lung tissues. And I will give you the heart to our colleagues from the Istituto Profilattico to take some blood samples for serological examination. Okay, look into the lungs. As said, there are some areas, whitish area, which are characterized by emphysema, presence of air. So these findings are not related to parasites, which can be another option for these whitish areas, because parasites usually are harder or a different consistency and texture. I'm detaching and taking off the esophagus. To facilitate the opening of the trachea. And here we find a lot of foamy fluid, red foamy fluid, which is basically edema. Edema is a very unspecific, non-specific findings. You can see these findings in many diseases, not just in drowning, which is not occurring in these animals, but you can see in a heart problem, liver problem, pneumonia, and many other conditions that led to death in the animals. But of course, this is quite severe and very, very red. So and also the surface of the trachea is very dark and very congested. And this could have some influence on the color of this foamy. This area, I'm trying to clean this. This area is you can see this part here with these holes. This is the tonsil, the laryngeal tonsils, which again is very important to have in case for infectious disease sampling. Other samples that we are going to take are those from lungs. And we are going to examine these tissues at macroscopic examination in order to assess the presence of and the nature and extension of the fluids, of other fluid of the edema, and understand that if there's any foreign bodies that can suggest water entering the airways, even if it is a very, very difficult and very rare condition. Of course, the microscopic examination would help us also to understand if there's any ongoing disease in the lungs. And these tissues will be preserved both in formalin for microscopic examination and in frozen for virology. So the next relevant organ is the GI tract. So the GI tract should be open to understand, in the case of suspect of bycatch, in order to understand the presence of a recent feeding, a recent food ingestion. So first of all, if you have a fresh animal, take a sample from the pancreas, and then you can start open the GI tract. By opening the three gastric chambers. Of course, it should be better opening this on a mesh that helps us in taking samples of the diet, also to analyze the diet, to evaluate the presence of any plastic debris. In this case, we know that the animal is quite a small one, a very young one. So, but what we can have here is a recent feeding, even if not fish, but this is milk. So we have a recent feeding, even if it is not corresponding to what we found in the gear, and that is one of the relevant points of our framework. The recent feedings means that the animal was healthy. The recent feeding means that the animal was active and maybe it was very close to the mother, and so we will again sample this not for any, well, the analysis already tool by catch, but for a toxicological examination that could be helpful to examine and understand what is ongoing there. So the other steps now ask for a sampling for an examination and sampling for all the other organs and tissues. I would just like to pay attention to the muscle. So we sample at the very beginning a large part of tissues. We need a very small sample for microscopic examination. So we take 1 centimeter per 1 centimeter per 1 centimeter about, because this is the real extension of a sample for microscopic examination. And we put here on a paper surface or a stick, which help to avoid any post-fixation problem. Because when we perform microscopic examination, we need to differentiate between the postmortem changes, including those related to fixation informally, and real changes. So this helps us to, to keep the muscle and the same condition we include informally, but also to write what kind of sample is if we are sampling more than one from muscles. The other tissue samples are dedicated to other analysis. So we can sample this amount for toxoplasma evaluation by PCR. And then the last one, the largest one, can be used and dedicated to heavy metals and for organic pollutants. So we have the 3 different sizes because we have to preserve tissues in a different way for different purposes. This for microscopic examination, including immunohistochemistry. This for PCR and molecular analysis, including in particular for toxoplasma analysis. And these 2 are for heavy metal analysis, in particular the largest one, which will be preserved in plastic bags, and for PCBs, DDTs, and many other compounds that will be preserved in an aluminum foil. The same will be done for the other organs. So the liver. The liver, we have to examine grossly also by doing some transversal cuts that can help to assess any problem also in the internal tissues. And then we will sample at the same way of the muscles, except for the paper support, because
what type of paper? Che tipo di paper è
come
quello?
si chiama?
Carton box.
Carton box, also wood stick. So something rigid that can help to avoid any contraction due to the fixation informally. The same will be done for liver. So again, 2 large sample for toxicological examination. 1 slice or 2 slices for the histology here, we don't need any support because we have no contraction related to the post-fixation. And then one part for microscopy for virology. Same for kidneys. So for kidneys, usually we cut kidneys like a sandwich, even if we have several ranunculi. And here you can see the different ranunculi. It's very difficult to find renal lesions except for big whales, for fin whales. There are some reports of herpes virus in the kidneys, not other relevant lesions. Also for the kidneys, from both kidneys, we should take samples for the same sets of analysis. So for toxicology, virology, and histology as well. We'll take later on just to. The last relevant organ is the spleen. The spleen is important mainly for infections. So we can just split in two parts. And one should be used for virology and bacterial analysis, other microbiological analysis. And the other one could be taken for histology. The heart. So, what? So the heart was empty at least, and now we are trying to open and take samples of blood or from the blood clots. We will try to recover some serum from the blood clots that we will find. So this part, again, the serological investigations are important to assess a previous infection. So again, I would like to remember that we should pay attention to the vessels here. It is not, and if there's any bubbles over here, but it's not easy to find, and it's not. So here, my personal experience, I have no relevant lesion associated to the heart, except microscopic examination. We open the right side of the heart, examining all the different valvular structure, and then we open the left side. Okay, here, and here we have the aorta. Aorta is an important vessel to look at for big whales and fin whales as well, for the same reason of their kidneys, because they are affected by a big parasites, which is called crassicauda, and which affect also the arterial wall, given some mineralization and also leading to death of these animals. From the heart, we take samples for histology because of to assess the capture myopathy, and we take samples for Toxoplasma gondii infections. I have forget to stress that we should take samples for histology also from the kidneys, in particular for investigating the capture myopathy, because when you lose myoglobin from the damaged muscular cells, all the myoglobin will flow through the circulation to the kidneys. And so you will find myoglobin by immunohistochemistry in renal section, microscopic sections. So one single part can be used for toxoplasma, and we can sample 2 or 3 different samples of this dimension from the heart, from different parts of the heart. So from the right side, from the left side, from the arm and the ventriculum, to have a representation, a good representation of all the possible tissues. So is there any question now? While then we will move to give some summary. There's also a question from the floor here. So Cristiano, do you want to ask your question?
Volevo solo sapere sul toxoplasma, hai citato numerosi organi, anche particolari, tipo la surrenale. Mi chiedevo se li fate sempre e se fate campionamenti multipli e quali sono i risultati.
Okay, so the question from Cristiano here from the room was that for Toxoplasma gondii, we cited several organs which has been affected by, well, they are reported in literature to be affected by Toxoplasma. So his question was if we sample all these organs every time during our necropsy. So to refer to necropsy like this means for cold 1 and 2 very fresh animals, we sample all the possible organs and we examine muscles, heart, liver, kidney, lymph nodes, and adrenal glands. In literature, several animals, in several postmortem reports, you can find that there is a strong reaction, also with lesions in muscles mainly, and in adrenal gland. So the adrenal gland is one of the location and tissues where you can see both a positive reaction, immune reaction, but also inflammatory lesions, so with the necrotic findings. And of course, I forgot brain, but the brain is not, because we never mentioned till now, and so this is another relevant, important organ. Any other question from the floor there?
Yes, Sandro, you have a question from Thierry. For the heart, do you have evidence of myocardial band necrosis of a live stranded dolphin?
No, we have no evidence of myocardial necrosis grossly, but we have evidence from, it happened to me one time to work with a live striped dolphins. We support and rehabilitate for 5 days, and then at the end, the animal died, and it died for myopathy. And we found no immunohistochemical changes and changes in the distribution of myoglobin and fibrinogen, also in the heart. We, along with the degenerative changes and necrotic changes to single fibers, not massive areas, but single fibers.
Okay, thank you.
Thank you for your question. Other question? So if not, we can move now to fill the form.
Sorry, Sandro.
Yep.
I have a message in the chat. Apparently, you talked about measuring the cortical part of the adrenal gland. Yeah. Why?
So so there are some papers linking the ratio between the cortex and the medulla of the adrenal gland with a stressful condition. They were performed by Cowan and colleagues in the early 2000s, in Texas, and were assessed by on Bodden's dolphins only. So they established that, and the hypothesis they established that the a different ratio between the cortex thickness and the medullary thickness was to stressful condition, a change in this, a chronic stressful condition, a change in this ratio, but also a change in the mass of the adrenal gland. So having a greater weight of the adrenal gland and a change ratio, so in particular, a greater thickness of the cortex compared to the medulla would be related to a stressful condition.
Thank you, Sandro. No
You're
more
welcome.
questions.
Okay, we can now move to fill in the form. So we have prepared this form here. Can you see the form? Okay. So we will then summarize the this form in a presentation we are going to send in the next week, along with the results for the microscopic examination. But this is just to summarize all our findings. So, fissure interaction in the animal history, specific for each category. So we just to show how the table was built, we put the categories of our postmortem findings. Here we listed the different findings, which are direct evidence of fissure interaction, other fissure interaction associated lesions, nutritional findings, specific findings, and other pathologies. Here we define the different type of possible fissure interaction. So active bycatch, passive bycatch, larynx entanglement, chronic entanglement, ingestion, intentional injuries or intentional killing. So fishermen that want to kill because they are disturbed by dolphins. And the final column is the DCC, so the decomposition code, where you are able to assess and tell what kind of code you can say something. So the first point is the fissure interaction in the animal's history. Well, we have here Cristiano. Cristiano, do we have any fissure interaction in the animal history?
In this case, yes, we have, because we received a call from a colleague that was called by a fisherman that said that he put this dolphin in his net, and they bring it to the port, and then we verified that this animal was fished.
Okay, thank you, Cristiano. So this is so we you can see here some letter. So the C/B means that this is a pathognomonic, means that there is a certain interaction. Then we have C alone, like here, which means that is consistent with. And then we have S, which means suggestive. And this is mostly based on your experience. But we have here a legend that is very helpful for the use of this document. So we have no presence of fishing gear, active or passive. We have net marks or linear signs. And this limits our hypothesis to an active or a passive bycatch. Then we have no other findings like presence of fishing gear around the larynx, penetrating wounds, no amputation with acute or chronic inflammation, no contusion or fractures. The capture myopathy is pending, so we have to confirm. We have no separation of rectus abdominis muscles, which is a very recently described findings, or linealgia herniation. Regarding the gas bubbles, we have just in the mesenteric vessels. We have some gas in the lungs, some gas around the kidneys, very poor amount. So it is very difficult to interpret this also in regards to the freezing process. So I would keep this as a incidental findings, and I will then ask for further investigation and evaluation, also microscopically. Or recently ingested esophagic or gastric contents. We have this, even if it was not fish, but we have milk. So we have a very recent feeding with a good NCC. We have no bulging of eyes. Oh, sorry. And then we have, well, for this microscopic muscular hemorrhages histology, it is pending, but we have other findings, which are specific findings which is suggested. So we have a pulmonary and vascular changes with petechia, edema, throat, blood, tinged watery fluid in the airways. Emphysema, okay. Incomplete collapse of the lungs, bulla in the lungs parenchyma. So there's some specific findings that is more consistent with the findings we observe in our necropsy. Multi-organ congestion, there's no relevant ones. There are some organs which were strongly congested, some others not. And absence of ongoing disease, which is still pending because we have to perform other analysis. So today, with a gross examination, but mainly based on the history that Cristiano told us, we are able to say that we have a bycatch animal. We have still to understand why the animal was in the net. So we have to, to examine better and going ahead with the other analysis and complete the analysis with other investigation, in particular microscopic investigation, to assess if the animal died for stressful condition like for capture myopathy, or because the animal was drawn, or I don't know. There's many possible hypotheses that we should investigate and understand if the fishing activity was the first cause of death or the last cause of death, which means that the animal was sick, or the animal was alone, or the animal, there are other causes and remain within the fishing gear. Of course, we can say that we have certainly an interaction with fishing activities. And so we have to count them in our final report, annual report, national report, but also to report to ACCOBAMS, IWC, and all the institutions that are dealing with the bycatch mitigation and interaction. Do you have any question regarding this point? There is a question that if you can have this observation. We will summarize this in observation, along with pictures, along with the videos, and the results from the microscopic examination and other analysis in a presentation we are going to send to you, doing by also with a video, and you can look at this presentation synchronously. So it's not necessary to follow again an in-presence meeting, but we will share with you the information next week, so when all the microscopic examination will be ready. So while transferring and moving to the brain, do we have any other information or questions?
No, doesn't look like it.
Okay, so this is the way how to open the skull.
So it is.
If I can explain maybe
Yeah.
just a sec. So you have to keep in mind that this is you have to keep in mind that this is a thawed and young animal. So in this case, I do it with this tool, which is quite powerful. The bone itself is not that thick, and especially some areas are not fused yet, so you can clearly do it quite easily. Usually we would use oscillating saw to roughly do this. In this case, we're doing just a rather small window. And thawed is because so it was frozen, the brain is not as firm as it would be normally, but still you can see a lot of the features which are pathological, and so I hand it over back to Sandro. But the only thing I could see was those bubbles here.
Yeah, there are some. Can you show with the? There are some bubbles within the meningeal vessels, which is again another features. Another features, yeah, that is very helpful to assess a bycatch. Look at here. And so usually bubbles, postmortem bubbles, so those bubbles are related to the presence of gas coming from the intestine, do not reach the brain when the animal is very fresh. So we can say that this could be a real gas. But again, we need to have histology to say this, to confirm this point. Okay. Do you have any questions or comments?
No, it doesn't look like it's on all.
Okay. I think
no,
that,
wait.
yeah.
You have a comment from Thierry.
Yeah.
Telling you that with La Rochelle, they have tested the electric saw of a battery to open the skull.
Okay. Electric, yes, with the battery, with the using battery. Yeah.
That works relatively well for small sedation, and on battery that work relatively well. It's cheap compared with usual tool used for surgery or medical equipment.
Oh yes, in fact, most of the electric saw are quite expensive, so it's not very helpful. You can use hand saw as well, like for slaughterhouses. But of course, if there's any electric saw and cheap electric saw that can be used on the field without any problem, it is welcome. Okay, so the main goal of today is to apply the diagnostic framework of on an animal and a fresh animal, and we were lucky to have an animal with a history of fisher interaction. So you can see that so it's a positive control, which is very helpful to test the bycatch framework developed within the Life Delphi project, along with all the other people in the belonging working in the Zooprofilattico institutes in Italy, and I hope that it will be helpful also in your country. We will share the documents. I already sent to you all the documents. We will summarize all these findings in a presentation along with the microscopic results and further analysis. And okay, sorry. And so the now it's the end of our our training for distance training. I hope to see you here in the next month. I don't know if the pandemic situation will change, but we have scheduled an in-presence meeting for you in February. We hope that we are able to do that. I really don't know, but I'm waiting you here in Padua and in Liège, if it's possible, at the beginning of 2022.